A community assessment of City of Westwego was conducted using research from the windshield survey, personal interviews from residents that been living in the city for a long time, the mayor, and the chief of police. Additional data collected from the internet, such as visit westwego.com, visit jeffersonparish.com, Louisiana Department of Health.gov, bestneighborhood.org, and worldpopulationreview.com. The community core. The city of Westwego was founded in 1870 by the Texas and Pacific Railroad. Looking at the neighborhood, they have center of commercial fishing, packing, and shipping industry. There are no new developed subdivision. People that live in this city have been living here for many decades. Population of 8,269 people. An old-timer interviewed reports that he has lived here for a very long time. His family came from the bayou. You can still hear his family speaks French, or he would describe it as Cajun French. This area hasn't changed much. There are 64.56% white, 23.68% black or African, and 11.76% others. There are restaurants such as Vietnamese restaurant that recently opened a couple months ago in the community, a Spanish restaurant, and Cajun soul food restaurant. There are many festivals going on at the farmers market, including the Asian Heritage Festival that goes on during a certain time of the year. The average per capita income in this community is about $37,104. This community is small, tight-knit, with rich history and values. You can see different churches around every corner. Non-denominational church, Baptist church, and a Catholic church. People take well care of their home, keep up with their lawn. Also, Salah Avenue is known for rich history of art. Recently, a rising fame artist, Joshua Wingirter, has performed his art with the city permission to put his art in many streets, walls, abandoned buildings to make the place look lively. Now we will talk about the subsystems of the community. First one is health and social services. It is reported that the city has a high rate of chronic medical condition. Leading cause of death is heart disease and type 2 diabetes. We are looking at the available and affordable health care for the residents. There are no hospitals in the city, but there is a clinic that recently opened within the year called GenCare Senior Medical Center, a primary care provider practice. There are no mental health services in the community. They have senior centers and community food pantry. Currently, no nursing homes available in the area. There are available resources outside of the community. It is accessible to the residents if needed and if they have insurance. The community is small, slowly thriving. Places for employment seems to be fast food place, grocery store like Piggly Wiggly, Family Dollar, and restaurants. For example, Joe's Cafe been around for a long time. Newly opened cafe. The economy has a poverty at 20.2% compared to Jefferson Parish that has 17.7%. Unemployment rate is about 2.7%. People of Westwego gather at Westwego Town Hall for news. The library has computer and internet available for the residents. Also, the farmers market has been a place where people shop, bring business, and many festivities going on. City of Westwego has a Facebook page called City of Westwego that keep people update on festivities, concerts, and recreational sport. Recently, a new sportplex opened called John Alario Sportplex. There's a gym and a walking track available in the community. Reports from the residents. The community is growing. The strength of the community is that everybody know everybody and they help each other. The problem is that they still have issues getting health care, and that seems to be a problem beyond the community. Even the minister reports that many of the church members have hard time making ends meet. The mayor is looking for a new way to grow the community. There are events that opened to bring in revenues and business. There are professionals that attempting to open business in the city of Westwego, but their business doesn't last a long time. The personal perception of this city is that the chronic medical condition relates to the poverty and lack of knowledge on healthy living. But the strength of the community is that people willing to help each other and involve in each other's lives. The nursing diagnosis for this community is that it's at risk for multiple chronic medical conditions related to inability to access and afford health care due to poverty and unemployment. Healthy People 2030 objective is that reduce the proportion of people who can't get medical care when they need it, code AHS04. The goal is to reduce the percentage to 5.9, but this has not happened. The percentage actually increased to 8.5% currently, that people are not able to get the medical care when they need it.